Today's topic is practical support for parents, tapping into resources. This is one of my areas of specialty because I've worked in the special education and disability services and early intervention and prevention services for about 12 years in this county. So I am happy to bring this to everybody, and this is going to be geared more toward families who they're either worried about their children's development or they already have a diagnosis or your child is having challenges in school, and you want some extra help in that way. I'm a behavior specialist and a parent, and my hope for all of these calls is to, number one, start your week off right, and number two, let you know about services I can offer. And then I also am really passionate about helping people access services that I don't offer, like special ed. I'm not a teacher, I don't work at school districts, but I can direct you in the way to get services through there. I'm a behavior analyst and I'm in network with Blue Shield of California, Anthem Blue Cross, United Healthcare, and Aetna. I've got openings in my schedule starting in February 2024 to access my services through insurance. The child needs an autism diagnosis through their medical record, and so that is, and I also work in parent-led, so I don't have one-to-one RBT doing direct therapy. I work in a holistic family-centered model. Today's takeaways, we're going to talk about school district services, where to start when your child struggles, and then bridging the gap between school and home. Valley Mountain Regional Center, VMRC, an overview of getting services, and an overview of what their services look like if you're eligible. And then services through health insurance. We'll talk a little bit about medical necessity and advocating for care. And again, comments and questions throughout, just pop them in the chat. So school district services. Most educators want to help their students learn in a safe, supportive environment that meets each student's needs, and most educators have too few resources to support each student and meet each need while being overworked and dramatically underpaid. Both things can be true. So when we look at scenarios about supporting students, we need to remember that a passionate educator is also operating at a deficit of resources. So coming at it from a supportive and positive zone mentally as the parent can be very helpful in collaborating to help your kid. So this scenario, the first one, is school-age child, no diagnosis. So you have not had anyone bring up concerns at this time. And the teacher starts to message you or talk to you at the gate that your child is having difficulty focusing in class and blurts out and interrupts during teaching time. So step one is take a breath and remember your kid is beautiful and the teacher is trying to communicate what is going on during the day and appears to need support. And then think about what your kid is like at home. So trouble focusing, he plays Minecraft for 12 hours at a time. That's something that my kid is doing right now. Think about your kid at home. So they do come home with unfinished classwork several times a week. They're super smart. They know how to do the work, and they can finish it in about an hour with some breaks jumping on their trampoline. And then you think, okay, they take breaks about every 15 minutes. And they always come back to the table ready to work a little bit better after the trampoline break. They're always on the go, moving all the time. They're playing outside, climbing, and they're creative and always talking and interrupting all the time. So you're like, okay, I could see that the interrupting all the time they do at home. So that aligns to school, what the teacher is reporting. And then they can focus on their homework. They know how to do it, but they have the movement breaks. So then we can think, okay, what the teacher's reporting may match up on the same things at home. Think about what's working at home. So you can think movement breaks, chunking tasks. That's something like, okay, go pick up all of your dirty clothes from your room. Okay, cool. Awesome. Thank you. You can play Legos for a little bit. All right, now pick up all of the little toys and put them where they go. Okay, cool. You can go jump on your trampoline for a little bit. All right, now we are going to put all of your stuffies in the net in the corner. So if that's kind of what you're seeing is most successful at home for your kid, that's probably something that we could go on the what's working at home list. And then a focused environment with breaks away from the environment. So if you're thinking, well, my kid focuses at home, they're working at the kitchen table, no one else is around them, and they have your individual attention if they have a question. That's a more focused environment than they're getting at school. And then with the teacher, how can what works at home be tried at school? Not everything is going to be directly mirror. You can't mirror a trampoline break at home at school most often, especially if we're talking about a general ed class, because your kid doesn't have any diagnoses. We're just in general ed, and the teacher is suggesting, there's some challenges going on. So things that I've seen to incorporate movement breaks, the teacher could start having your child run errands to the office, take a paper up to the office, and then get them back into class. And that would get some movement, get a little bit of time away from the task. Chunking tasks, taking breaks. Maybe they could maybe they could have a fidget at their table they could do a page of work, depending on the grade level, play with their fidget and do the next page. And then moving the seating around is a focused environment, works at home. Moving seating around to find the best location for attending to tasks is something that is pretty low impact as far as affecting the teacher's daily work. And my child, when she was in kindergarten, talked a lot. And we could not figure out how to get her to stop talking in class. So the teacher, it was fantastic, and moved her around to try to match her with students who didn't talk as much. But my kid's quite magnetic, and she just got everybody into it. So my mom went into volunteering class, and the teacher had put a desk in between Zoe and the next kid closest, and it was working a lot. So I asked my daughter, like, do you notice, how's your new chair? She goes, oh, it's fine. So it didn't affect her, and it got her to talk a little bit less. It wasn't isolating or anything, but the seating is a very low effort way to change things for focus and for chatty kids. Is something I've seen. And then step 4, ask for a chat. So you could do Zoom, you could go in person, talk about what's working at home. It's very important to keep in mind what is working at school as well, to keep a positive lens on the situation. And then how to bridge the gaps of what's working at home, how can we try to mirror it at school, and vice versa. Something that's helpful for us, for my family, is using school terms at home. So the quiet coyote, green choice, red choice. So if that's what the classroom language is using, if parents start using it at home, it creates kind of a united front and more continuity in the expectations for the child. A lot of kids benefit from their settings, their home and school settings mirroring each other if they're having trouble meeting expectations in one or the other. Using strategies that work at home at school, talked a little bit about that. And then if we can, add a little bit of pressure at home. So maybe movement breaks every 20 minutes instead of every 15 to practice attending to a task longer. Just tiny little changes that don't make a huge negative impact at home where the kid is successful, but can potentially help by building up some tolerance for working on tasks a little bit longer at school. And then keeping track in written form of how things are going in home and school. We'll talk about it a little bit later, but the written piece is so helpful because it's in the moment. If you take notes every day, it's in the moment, you're not going to forget. And then documentation is very important when we're looking at a busy family schedule and a teacher who we've already established we understand doesn't have enough resources, no matter how kind they are. They need extra help, and keeping notes will help them report accurate information as well to what your kid needs. So that's what we're talking about. Communication attempts. And I have a resource on my website called the communication log, and it's got things that I find important in my years of experience to keep notes. And it's just a downloadable form if you need ideas on how to keep notes. Communication attempts, both the school and the family, who's reaching out, meeting and notes, who's committing to what. That's very important, because if it's just like Johnny would benefit from XYZ, well, who's going to be doing that in class? And then next steps and who's committed to what. And then it can be helpful, when are we going to talk next about this? Keeping in mind changes take time, so maybe every few weeks you reach out to the teacher. And that scenario applies to kids who don't have diagnoses, no individual education plan, an IEP, as well as kids who do have an IEP in place. And bridging the gap between home and school is the best, fastest way to help, because you have control at home over the environment, and we don't have a lot of control at school, of course, because we're not the teacher, we're not there. So working as a team to make those environments mirror each other is a very effective way for parents to do their part and bridge that gap. So what matters most in school, when my daughter, I'm going to tell a little bit of a story. She's spicy, and we had a lot of concerns going into kindergarten for her because we were having a lot of behavior challenges at home. And preschool, she had gotten a little bit uh, more prone to tantrums if there was transitions. She doesn't have diagnoses, so we're just dealing with, this is kind of that scenario one kid. There's no supports existing for her. And we got very lucky. We had a great kinder teacher who helped us. We were late many, many days that year because she would just sit on the floor and stare at me in the garage, and I would have to wait her out until we got in. And she was a very young kinder as well. Her birthday was 5 days before the cutoff. So she was a 4-year-old kindergartner with a spicy personality. So we were late a lot, and I had communicated to the teacher, like, I can't strong arm this kid into the car seat because she's huge as well. So like, I don't know, she's very strong. Like, we're kind of just dealing with what we're dealing with, and they were supportive. She did really well that year. And then in first grade, I did my most important thing for her. What matters most is she feels successful. That's all that matters in kinder and first for me. She feels successful and supported and has a good time at school because she's got a lot of years left. So first grade was getting a lot better getting into the car. She was very chatty. She did a lot of touch her friends. She was like, she was just very handsy, always wanting to hug, even if the kids didn't want hugs. So the school teacher said, we don't touch our friends. We use that at home. We don't touch our friends. Um, then in second grade, she's in second now, I prefaced it. I just sent a little message to the teacher. Hey, let me tell you a little bit about Zoe. We talked a little bit about Zoe. She's a beautiful soul. She's super bright. She is just like so friendly and kind. And then these are a few of the challenges that first grade saw. And this is what we do at home. We use this language. And then if you have any language for school from first grade, because each teacher is different, if you have any language from second grade that you prefer to use, we can mirror that. And she gave us a little bit of a red choice, green choice, um, and just a few other things that that teacher specifically uses. And this year has been the most successful year so far because that I've had the practice of bridging the gap. So it all stemmed from what matters most is her feeling successful at school, and we just go from there. It doesn't it helps to keep it focused on how we're going to approach things because we know what the ultimate goal is for her. All right, type any questions and comments in the chat. Okay, so we talked about school services, and now we're going to talk about home services, which are regional center and insurance services. Home and community-based services range from early start, which is ages birth to 3. That's early intervention. You're seeing your kid has a little bit of a delay in some area of development, and you seek help for that. There's medical insurance. I'm going to talk specifically about ABA, which is Applied Behavior Analysis Services, and it's through medical insurance largely for kids and adults diagnosed with autism. And then there's Lanterman Services, which is Valley Mountain Regional Center, and that ranges from ages 3 years old through end of life. Okay, so we'll start with early start. This graphic is in order to qualify for early start services, you need your child needs to be delayed 25%, which just means their chronological age, one of those areas of development is delayed 25% behind. So if they are a year old, there's 12 months. And if any of their expressive or receptive communication or any of those on the list are 9 months and lower, then they would qualify. That's a 25% delay. What's true? So Valley Mountain Regional Center is who in our catchment area or in our county covers the early start services. So true, parents can refer their own kid to VMRC. And early intervention is so important, even if your pediatrician is not concerned. Your doctor does not have to be worried for you to ask for an assessment from VMRC for early start. A doctor doesn't, and then false, a doctor does not have or has to refer to early start. I have a lot of families who say, well, my doctor's not worried. How can I get services? And that you can self-refer. And then also false, if only the parent is concerned is probably not a big concern. You know your kid best, and it's very important that you ask for an assessment. And if the assessment comes out, there's no concerns, great. You can check that off your worry list. And so regional center, oh, hold on. Okay, so that's early start. And then over 3 regional center is if there are a developmental disability. So there's your child's diagnosed with epilepsy, cerebral palsy, autism, intellectual disability, or a 5th category like a traumatic brain injury may qualify. And parents can refer their own kid for assessment and services for regional center as well. And VMRC, which is our regional center here, is the payer of last resort. So every other resource, it's called a generic resource, has to be exhausted. So if you want a certain service from Valley Mountain Regional Center to address some core deficit related to your child's diagnosis, they have to make sure that your insurance wouldn't pay for it or there's not other community resources that would pay for it. False about regional center eligibility is you have to have an IEP to qualify. That's not true. You can have school district services and regional center or one or the other. And then another false is if your child's autistic, they automatically qualify. So that's not true because regional center, you have to have a substantial disability. So along with all of these diagnoses come some criteria for eligibility that we don't have time to go into today. These are available supports, but not everybody qualifies for every support we go over. And then there's medical insurance. So each plan is structured differently. And then the best way to determine if your child is eligible for services through their medical insurance is calling the member services phone number on the back of your card. That's where you're going to get the best information regarding you specifically and your child specifically. Calling a provider like myself, I I usually will reach out to the insurance too, but only after the person has called their member services number, because there's oftentimes some nuance between the plans that are different that I'm not going to know about, that the member would be able to find out about. Doctors can't just write a prescription for ABA for most insurance plans. There's referrals. Sometimes it's just one of those things that sometimes a doctor will write on a prescription pad ABA, and that doesn't work. But you can find out what will work by calling member services. And then another thing that's not really true for everybody, if your kid's autistic, they need ABA. No, there's a lot of different developmental profiles. There's a lot of different ways that kids learn. So just because you get an autism diagnosis for your child, a lot of times you'll get this big handout like, okay, here's how to call speech, here's how to call occupational therapy, here's how to call ABA. You don't have to do all of it. You can pick what's most important in the moment and then go from there. There's a lot of pressure about, well, early intervention is incredibly important, so we have to throw everything at our kid, and then the child gets overwhelmed and they don't have any downtime. So it's really an individual family's decision. Okay. And then there's types of ABA services. So ABA is a behavioral science. There are many ways to use that science to teach new skills. So you're going to hear a lot, if you are looking at ABA through insurance, there's going to be something called the comprehensive model, which is a high number of hours a week, 25 plus hours a week. That's usually for individuals who have delays in all areas of development or significant behavior challenges. Then there's a focused model, which is usually around 10 hours a week, which is one or two areas of delay or challenges that don't require as many hours a week to address and train parents on how to do it. And then there's parent-led, which is what I do. And it's also called caregiver training. And it's where the parent, you're with your kid the most, and the practitioner, which is someone like me, will train you and model how to integrate the things that will help your kid learn into your daily routines. So there's a ideal candidate for each of those models, and the parent-led model is usually 1 to 4 hours a week, and one 1 to 2 visits depending on the child. And then there's another resource on my website that goes into this a little bit deeper as well. Then we're back to school. And school has a variety of sports supports and many eligibility categories. So there could be solely low incidence, which is like hearing loss or vision impairment, all the way up to emotional disturbance and autism, that potentially any of these eligibility categories might need any amounts of supports, which could be as little as like speech consultation to as much support as like a separate classroom. And school services don't qualify students for services out of school. One of the things to remember is a child can be eligible for school supports and not eligible for regional center, and not eligible for medical insurance, or eligible for one of those others and not all three. And then if your child's autistic, they don't necessarily need an IEP. It just really depends on what struggles you're seeing and the school is seeing for your kiddo at school. And then this is how they all work together. So there's many supports available. Your kid is in the middle. There's many supports available. Services should be individualized, and the parents need to be involved in all of these. More is not better. It's really this finding the sweet spot of where your child is needing support, where they're doing really great, and then finding the perfect amount of support is better than supporting in all areas, even if your child doesn't need it. And professionals don't know best. You know best. And finding a professional who can pull out what you are seeing at home and translate it to school and vice versa is usually leads to a more balanced profile of care for your kid. Um, we don't live at your house and we can't say, everything, oh, this is what you're doing right and this is what you're doing wrong. It has to be a collaborative approach in order to best serve your child. And then again, questions and comments. My website has the blogs and resources page has a bunch of detailed resources on the topics today. And I didn't go into every little bit, but there's a lot. It can help to have the hyperlinks to click and all of that. So there's lots of resources on all of these topics on burgosbehavior.com. And then if you have any questions, now's the time. And then our next session is January 22nd, and we'll be talking about understanding your child's behavior. We'll talk a little bit about the basics of behavior and then coping skills and assessing how your kiddo learns best at home. And then if you need anything, admin@burgosbehavior.com, and that's my number.